Bonjour. Good afternoon. Like all of you, I was appalled when I heard of a patient passing away while waiting to be seen in hospital. This is simply unacceptable and just the latest example of the crisis we are facing in our healthcare system. I want to extend sincere sympathies to the families and friends, as well as to those who were in the emergency room that evening, either working there or waiting for care as a patient. This is indeed a traumatizing event and not something we expect to happen in our province. Il s'agit de l'événement traumatisant. On ne s'attend pas de voir quelque chose comme ça se produire dans notre province. We have asked Horizon Health Network for an investigation into this death, and if we are not satisfied with the results, we will be asking for an external review. I have no doubt that every New Brunswicker and all of our healthcare workers are saddened and concerned by this story. We all want to know that when we go to the hospital, we will receive the help we need. We are not alone in these challenges, however, facing healthcare in our entire country. Nous ne sommes pas les seuls à faire face à ces défis en matière de soins de santé. While attending the Council of the Federation meetings earlier this week with the other premiers, we met with nurses from across the country. They arrived with large signs that said, "Healthcare in crisis." And as a country and a province, we are in a crisis. I heard similar stories from my colleagues across the country. J'ai entendu des histoires semblables de la part de mes collègues partout en pays. As Premier, I'm here to tell you that I am prepared to do whatever is necessary to protect and improve the healthcare system in our province. We are now at a crucial turning point. As a government, we must engage our frontline workers, our doctors and nurses, to be part of the solution. I hear you. I hear the frustration of our frontline workers. J'entends la frustration de nos travailleurs de première ligne. The nurses who end up working 24-hour shifts because there's no one to replace them is just unacceptable. The staff who can't take much-needed vacation or time off. This is unacceptable. The ones who can't call in sick because if they do, there's no one to cover that job. It's unacceptable. Workers being unable to have the flexibility in their schedule they need to coordinate with their fellow workers, time off, or to substitute for family or major events of importance. Patients being treated in a retrofitted conference room because there's no space in the emergency department. It's unacceptable. And wait times of up to 12 hours or longer to be seen in an emergency room. It's unacceptable. I know there are similar stories across the province. Every premier, every province, and every healthcare system is stressed. Situation semblable dans l'ensemble du pays. Tous les premiers ministres, toutes les provinces et tous les systèmes de soins de santé sont sous pression.
Sure.
It's not up to me to run the healthcare authorities or run health authorities, but it is up to me to ensure that the right people are in the positions to do so. And it starts at the top. Beginning today, Bruce Fitch will take on the role of Health Minister. Dorothy Shephard will take over as the Minister of Social Development. I appreciate all the hard work done by Minister Shephard. Her job has not been an easy one, especially during a pandemic, and I want to thank her for her dedication to the people of this province. And I'm sure that dedication will continue in the social development portfolio. She has been committed to the challenges and has helped bring changes, such as improving access to mental health and working and improving wait times. À faire face aux défis. Elle a aidé à apporter des changements comme améliorer l'accès aux soins de santé mentale en travaillant à réduire les temps d'attente. Also, as of today, Dr. John Dornan has been replaced as the CEO of Horizon Health Network. Margaret Melanson Currently, the Vice President of Clinical Services for Horizon will be the interim CEO. As well, both Horizon and Vitality Health Network boards have been revoked, and trustees will fill their positions. Suzanne Johnston has been appointed trustee of Horizon, and Gerald Richard has been appointed trustee of Vitality. We are fortunate to have two outstanding and experienced individuals to come out of retirement to help guide us through these challenging times. Nous sommes chanceux d'avoir deux personnes exceptionnelles et hautement qualifiées qui sortent de leur retraite pour nous guider à ces moments difficiles. We have a plan. It needs to be implemented. The situation we're in today is a result of many, many years of successive governments refusing to deal with urgent situations. La situation d'aujourd'hui découle de très nombreuses années de gouvernements successifs qui ont refusé de s'occuper d'une situation urgente. It is imperative that we take action now. Since taking office, we have steadily increased the healthcare budget at an average of 4.2% each year. This year's $3.2 billion budget represents an increase of $168 million, the largest increase since 2008-09 fiscal year. However, an increase in spending is not the sole solution. We also have an opportunity to innovate, and we must take it. Part of making that happen is for the regional health authorities to work together. If something is working in one area, share it with the other. Si quelque chose fonctionne en soins d'une régie, cela devrait être communiqué à l'autre. For example, Vitality is achieving excellent results in a number of areas in spite of challenges that they are facing. They have hired 275 students to support their teams this summer. They have prepared their first cohorts for nursing support services training with CCNB this fall. They recently returned from their first overseas mission that opened the door to approximately 50 hires. These are just a few of the positive examples in the progress that is being made. Ce sont les quelques exemples de progrès accomplis. Both networks have achieved success in reducing mental health wait times, hip and knee surgeries, and, of course, managing through COVID-19. Working together, they will continue to find ways to better serve New Brunswickers and ensure that we have the best healthcare system anywhere in this country. I see the posts on social media, and I hear the nurses, doctors, and people waiting for care who are struggling and suffering. We have a dedicated workforce of healthcare professionals who are committed to helping patients. Nous pouvons compter sur des professionnels de la santé dévoués qui veulent aider leurs patients. I know you feel those concerns you raised have been and are falling on deaf ears. I want to assure you, I am listening, I hear you, we all will be listening, and we all will be reacting. If there's a bureaucracy stopping things from happening, let's remove the barriers. Our government has demonstrated its ability to make difficult decisions in the face of adversity. And today, we are doing just that for healthcare. I am committed to ensuring that New Brunswickers have a healthcare system they can absolutely count on. Thank you. Merci.
Merci beaucoup, Monsieur Premier.
Thank you, Mr. Premier.
Higgs will now proceed with questions from members of the media. Each reporter will have one question. You have the right to pose your question in the official language of your choice. Nous allons maintenant procéder au...
We will now proceed to reporters' questions, and you can ask your question in the official language of your choice. Every reporter can ask one question. Jeanne Godin, Radio-Canada, Acadie. Thank you.
Je vais commencer par poser la question concernant l'ex-ministre de la Santé, Dorothy Shephard. On entendait beaucoup parler des problèmes dans nos régies de santé, Horizon et Vitalité, depuis plusieurs mois. Pourquoi avoir attendu aussi longtemps, avoir attendu à aujourd'hui, avant de la remercier.
Never a good time, I guess, to make significant changes. And there's always, need to get a clear understanding of what people are doing, what changes are forthcoming, how people are working together. We had great success working together with COVID, and we saw the two networks that were complementing each other throughout the entire process. Minister Shephard played a key role throughout that. And certainly as we move forward in the hip and knee and mental health, we were making progress. We have a health plan that we put together, roughly a year ago, and that plan must be implemented. And I think what you've seen from what I've put forward here today is basically we're declaring, in the interest of public safety, in the interest of our public, we must have changes in our health networks. We must ensure that our management structure reacts to situations on the floor. We must ensure that the managers are listening to the nurses and the doctors as we change. We must have doctors and nurses prepared to innovate as we look for ways to have a better service delivery model, because we are faced not alone in the challenges that are in front of us. So I would say that, reacting today has been primarily brought on, but not only what we've seen today throughout New Brunswick and what we've seen recently, but what I saw across the province in meeting with all my colleagues. We have no time to waste. We must find ways to innovate. We must find ways to get better healthcare results. Our citizens are dependent upon it. I've learned that we're in competition with every other province. We worked with Atlantic Canada premiers in order to find ways for synergies. We'll continue to do that. But right now was the time to say we need structural change in how we manage and implement a healthcare plan that needs to move forward. So it came to a realization that there needs to be a move forward in a different direction, but removing bureaucracy at the time in order to make it happen.
We'll now go to Andrew Roy with Brunswick News.
Thanks, Bruce. Premier, so you've dumped a lot of people, but you still don't have enough healthcare workers. I mean, how does removing all these people solve the problems when you just don't have enough bodies?
So, Andrew, I think what's an easy thing to say is that, well, we can't fix anything because we don't have enough workers. And while we'll continue to look to hire more in all aspects of the healthcare profession, every single province is saying the same thing. And so every province is out looking for more people. So if we hide behind the shield that we don't have enough, or we look at our per capita requirements and we look at our per capita capabilities, and we look at how we schedule and utilize our employees and our buildings and equipment, how we manage to do elective surgeries versus critical surgeries, how we manage to work with one hospital to another by staffing an ER, maybe in different nights, and I would think of hospitals that are right in different areas and could complement each other. It's not good enough to just stand back and say, well, I can't do any better because you can't hire more people. Andrew, every single province is facing that. So if we want to use that as a shield, we have made some major improvements in our ability to bring new immigrants in our ability to have more employees trained, more nurses trained. That's gone up dramatically over the last few years. So we're moving in those directions, but you can't rely on that alone, and you can't stand back and say, well, I'll continue to do what I've always done because that's the way it is. No, Andrew, that's not the way it is, and it's not the way it needs to be. We just need to think a little bit out of the box.
Thank you. Merci beaucoup. On va passer. We're now going to proceed with Alexandre Boudreau, l'Acadie Nouvelle.
Ministre, j'essaie de comprendre. Est-ce que vous avez dit que vous avez, dans le fond, les conseils d'administration des réseaux, vous les avez renvoyés, vous les remplacez par les chefs de la réforme de la santé? Est-ce que j'ai bien compris?
You did understand that correctly. Under the actual regulation, the Regional Health Authorities Act, we do have a category there which is entitled Appointment of Trustee. It's actually Article 58.1 through C. And it states that we have the ability to do this in the public interest. And so what we're trying to do in this case is say, okay, we're going to have a board of 2 members, one on Vitality and one on Horizon. And they're going to work with the CEOs in order to make decisions, in order to do it quickly, in order to make things happen, and to work with the professionals on the floor to do it quickly, to make things happen. If I go back to the early days of COVID, I remember a great learning for me was that when we were asking what type of clothes to wear, what type of protective equipment to wear, and it was 2 weeks later and 24 signatures that we found out, okay, this is what we all agree on. You know, if we're in a crisis in healthcare, and if every nurse in the province and every nurse across the country and every doctor across the country is saying, oh yeah, we're in a crisis, well, all right, we are taking a crisis management approach here to allow decisions to be made, to allow direct consultation with appropriate people, and then get on with it. So we're removing, this situation of kind of a bureaucratic stalemate. We're removing, and this isn't intended to be permanent, but this is intended to get results. And right now, I need to see results, and I want to remove the barriers and the roadblocks for our health professionals to achieve them.
Merci beaucoup. Harry Forstall with CBC.
Thank you, Bruce. Premier, are you able to hear me?
Yes.
Yes.
Wonderful, thank you. These are wholesale changes, as you point out. What has Dr. John Dornan, who's only been in the job for 4 months, what has he failed to do in your eyes that deserves that he be removed as CEO of Horizon Health?
So I don't think that, Harry, I want to get into particular issues in relation to individuals, but I think what I'm demonstrating here is the need to get a groundswell in relation to frontline workers in the case of Margaret Melanson and her role in clinical services, and how we can direct that on the hospitals. I mean, I think in every hospital there needs to be a manager of clinical services that is really that gatekeeper of who's coming in, who's going out, what's the time in, how quickly are we managing that, and we need to get on the ground with issues. So what this reflects is that ability to get on the ground, get in the hospital, and make things happen. And so what I was asked, a while ago, was kind of who manages clinical services for the province of New Brunswick. And you know what? That's not I can't put a name to that in any particular reference. But every hospital needs that manager or had some relevance of that responsibility. It can't be a bunch of people. It needs to, every hospital manages clinical services and then someone looks at it over all in the province. So we ensure that we are utilizing our hospitals throughout our province, whether it's in Vitality or Horizon. We're allowing people the option for the best health care anywhere in the country. And it might not be next door. You may live in St. John and this opportunity is in Bathurst, or vice versa. But the idea is that if it's available in New Brunswick, we want our people to have access to it.
Thank you. We're now going to go to Nick Moore with CTV.
Premier Higgs, you say that you're asking Horizon to do an investigation about what has happened, and depending on the results of that, you may or may not do an external review. But what questions do you have from that investigation, and why not just do an external review right away?
So my point is how do we hold people accountable for delivery? So if we have standards in the emergency room, and if those standards say you're supposed to, do the vitals on someone in the emergency room every 30 minutes or every hour or whatever, I think it's every 30 minutes, then okay, if that didn't get done, then what were the mitigating factors that caused that not to happen? So were there too many people in the emergency room waiting to be admitted? And were there no beds to actually allow them to be admitted? And were there people that should have been discharged in the hospital that weren't discharged? So I expect those kind of answers. So I don't believe this is anything to do with, and I'm just stating an opinion here, anything to do with the nurses on shift or the people on shift. I believe it's a management issue. I believe that there's no coordination of activity. And that's what I'm trying to drive home here. If we don't get better management results in our hospitals, we won't get better health care. And we can continue to put more money into it, and we will have to put more money into it. But we need accountability and delivery of results. And we need standards that are consistent across the province. And we need people in other parts of the province or other hospitals that have best practices and they're seeing these results. We need to learn from them, whether they're Vitality or Horizon. This is a sharing moment for us to have the best healthcare together.
Natalie Sturgeon, Global TV.
Premier, your government was warned both by organizations that represent workers in the healthcare sector and healthcare workers themselves, either through social media or letters that they have written to your now former health minister. How are you going to prevent this from happening again outside of eliminating that bureaucracy at the top?
Well, I think the very point of having standards that we're measured by to see if we're improvement. What I've always been, consistent about. I want to see is our patient connect list is the wait list going down. If we are reporting each hospital and wait times are 2 hours or 10 hours, okay, what is happening in that hospital where they're 2 hours? And maybe obviously in different parts of the province there's different usage rates, but I want a standard that is accepted, presented to the public, very visible, and lay it out there for the public to see in relation to one hospital over another. How well are we doing? Because if we're agreeing to a standard, then that means all over this province. It's just not in one area. And I know there are specialties, and we have to take that in consideration. So my point is, what it seems is there's always a reason not to change. What we're showing right here, we have primarily 4 people. Obviously, you have the deputy minister that's part of that, the minister, but we have 4 people in charge of operational activities within the network, the 2 CEOs and the 2 trustees. And they'll work with the people in the field, in the hospitals, but they're accountable for delivery of service. And I'm expecting a report card that says, are we getting better? Where we got problems? And how are we addressing them?
How are you going to avoid another New Brunswicker dying in these circumstances?
It's a great question. And the only way I guess I can answer that is we're taking every step possible to ensure that we put in the right management activity to allow nurses to be heard, safety concerns to be listened to. I mean, there's probably many voices that have been expressed right internally to managers in the system, and they haven't been listened to. That is not acceptable. So that's the goal. But, will there be cases? Will there be problems? I couldn't stand here and say there won't be. But for us not to react in a meaningful, direct way like this and say, this is a crisis. And we're told it's a crisis, we accept it's a crisis, and I'm not kicking it down the road.
Vicky Hogarth, CHCO TV.
Thank you, Bruce. Premier, taking on the role of health minister during a global pandemic is obviously not an easy task. Why do you think Bruce Fitch is fit for it, and why did you pick him?
So I think that it's not easy to make changes like this, and I commend Dorothy for the great work she's done throughout the whole program, and through the pandemic, as I said, and changes that we've been working together on. In the case of Bruce joining, sometimes a change is some say better than a rest because people look at it differently. There are things that need to happen. Bruce is a seasoned individual within the province, within government. Has a ability to work. As he'll work with people anywhere, as Dorothy was, but bringing in kind of a fresh look at how do we measure performance? How do we deliver on results? Where have we not provided and followed through on the commitments that we've made, and what were the root causes of that? Because every one of us rely on the civil service and the people working in the system to make things happen. And so I don't want to be making statements here or coming up with something that people don't believe that is possible. I need to provide the right team that says, this is possible, we can make this work, and then make sure it gets delivered upon everywhere in the province. And I think that it's much as saying, okay, we're going to give a new minister a shot at this because it's been a tough few years. I mean, the whole COVID thing, it was not easy on anybody. And we talk about healthcare workers being tired, and it's real. And the same with, professionals in many, many areas. It's not really any different in the case of the political world and in the ministers. And so I think we have an opportunity here to refresh and understand what Dorothy has been through, and also an opportunity for another colleague to pick up and move forward in a very important file.
Thank you very much. Erica Butler with CHMA Sackville.
Hi, Premier Higgs. Hopefully you can hear me.
I can.
Yes.
So I'm talking to you from Sackville, where local groups have been working for the past 2 years to restore staffing at the Sackville Hospital and recently announced some successes in the nursing department. There was talk here about possibilities of restoring some localized control, introducing some stability, and I've spoken to doctors who would argue that centralized control and big top-down decision-making, especially 2 years ago, is what landed us in the mess we're in now. Isn't what you proposed actually sort of a direct government takeover of healthcare management in the province, firing a CEO who's just permanently hired, eliminating a partially elected body that has a role to play in healthcare management? It sounds like you're doubling down on top-down centralized control, and I'm wondering how that will square with efforts like we have in Sackville to restore some local control.
Well, you may have answered your own question. So how's the past been working for us? How's the past structure been working for us? And if the past structure was working, if it was working so well, would we be in this state? And I would argue that it hasn't been working so well. So we are in a crisis. We were in with COVID. We are in a crisis in healthcare, not unique to New Brunswick, but unique to the process of who has ownership. I am not looking for a centralized or enhancing a centralized approach to the point that you're making. In fact, if the teams come up with strategies that say, look, this is how we should manage our local hospital, I am very much in favor of a local hospital management program where they actually take responsibility for the activities in the hospital, not just whether the lights are on or the heat system works, but the clinical services and holding people accountable for the actions in the hospital. And we don't have that in our province. We don't have that in any hospital. So, but we do have it in the CEOs starting to, and I see that particularly in some areas. And that's the goal. So what we're doing here is basically setting up a structure. Let's fix this situation, and then we decide what should it look like going forward in order to ensure it stays fixed. And in different regions, it could be a different model, but not having accountability for results and performance, and not every individual being part of that accountability is not acceptable. If you're working in the health system, we need you. We need you to be part of the solution.
Thank you, Ms. Butler. Now, we're now going to go to Brittany with allnewbrunswick.com. Brittany? Okay, we're now going to go to Pascal Rochenag, Radio-Canada, Acadie.
Bonjour, Monsieur Higgs. J'aimerais savoir qu'est-ce qu'est la suite des choses pour les conseils d'administration de Vitalité et Horizon. Vous dites que c'est une mesure qui n'est pas permanente. Est-ce que vous avez un calendrier pour le retour des conseils d'administration? Comment va se passer la suite des choses?
And in the future.
Yes, I said this isn't a permanent solution, but I don't have a timeline because our timeline will be based on our ability to see the results we need in healthcare. But I want to be able to demonstrate what that means. What that means in terms of our ability for a number of people that are hired in the system, our ability to manage staff, our ability to surgeries, our ability for patient connect and primary care. So there's going to be some targets that we'll be setting out there that we want to achieve first. So I can't put a timeline on it, but I do want to be clear on what the outcomes need to be.
Thank you. Sarah Seeley with Brunswick News.
So my question is about some of these statistics, and I was looking for statistics on how many patients walked out of ERs without being seen, and those stats weren't readily available to the public. I was just wondering, with some of these changes, if you'd like to see statistics like that presented to the public, and also what these changes will mean for improving wait times so that patients aren't waiting so long.
Yes, I would like to see stats like that. But if people come in and don't register and they leave, if they're in and they're registered, then they leave. I guess that you could look at it as any customer service model. You've heard me mention many times about my focus on a customer service, and I believe that every patient every taxpayer. We are served as a government, as a bureaucracy and civil servants. We serve the public. So I would like to see stats in that regard, but I don't know what the right time frame needs to be. And I know we're talking about different triage mechanisms so that we don't have people that don't need to be in the ER staying longer. How do we use advanced care paramedics? How do we do that decision rate at home before they ever get to the ER? And that is something that's being implemented as part of our health plan. But I think ultimately, you could compare this to other service models, and when people are getting the timelines and you see the clock ticking, I don't want to put added stress on our healthcare workers. I just want us to be able to provide what's needed to give the service that's expected and to support the individuals that are delivering that service. So we're not asking them to do something they just cannot possibly do.
Thank you both. Carissa Donkin with CBC.
Hi, Premier Higgs. I'm just curious, just to build on Nick's question earlier about Horizon's internal review that they're doing into this patient's death. I mean, these reviews are typically internal. They're not usually made public. You've mentioned, holding people accountable, and you've used that word accountable and accountability a few times today. I'm just curious, what ability are you going to, what would you ask Horizon to do to make sure that the public can understand what happens here? I mean, do you believe that review should be made public? What ability is the public going to have to ultimately know what went wrong here?
Yes, I do believe that the public needs to know exactly how this situation was handled, what demands we were placing on individuals, patients that were unachievable, and how we were going to change that practice in the future. And I expect that sort of clarity, and I want to be able to communicate in the same clarity, or Minister Fitch will, in relation to what is being done precisely differently. I think too often we do a report, we put in a whole raft of recommendations, and then you kind of wonder, did any of the recommendations actually get done, but it finalized the report? Well, what I'd rather see is, okay, here's what happened, here's where we have changed, and this is implemented as of today. Or tomorrow, or whatever the time, but it's very clear what's changed. I'm not interested in 30 recommendations. I'm interested in seeing a new program that would see that patients are looked after when they're in the ER, and we don't, let's say, get caught in a staffing situation that will not allow that to happen. And again, I reiterate, I believe this is a process issue. It's a management issue, and we need to set our standards high and not just say, well, we didn't have enough people or we had too many people in the ER, but be very clear what we can handle, how we can handle it, and that we can do it safely.
Thank you. Alison Sampson with CTV.
Good afternoon, Premier. My question is kind of adjacent to these, but I'm working on a story on vaccinations, and many parents have kind of waited to vaccinate their kids under 12. I'm wondering how the province is going to encourage parents of even younger children under 5 to vaccinate.
I believe that we are also having vaccines. If I understood the question, I didn't hear it all, but in relation to having vaccinations available for under 5, and we currently have vaccinations available for that too. We just accepted that, is my understanding.
Yes.
Was that the question?
Yeah. Yes. Well, I'm asking how you'll encourage parents, since it was already a little hard to get people to vaccinate the kids that were over 5, under 12. How you're going to get people to vaccinate kids under 5?
I know it is a concern, but there will be a campaign put in place in order to address this and the safety of the vaccines and the importance of doing so. So public health will be proceeding with that. I know it's a struggle, and it's an issue with overall vaccinations. We've reduced the age limit to encourage people to get their 3rd, 4th dose, and we are, seeing increased cases, albeit, to varying degrees of severity. But we've always been told, and I still believe it, vaccinations is our safest passport to health in relation to COVID, and we're encouraging people to do that. So the public health will be putting out a campaign in relation to the younger folks.
Thank you, Ms. Sampson. We're now going to go to Catherine Morrison with Brunswick News.
Hi there. Thanks so much for your time today. Mr. Premier, I'm wondering what impact will these changes in leadership have on health reform timelines?
Oh, what was the last part of it?
Catherine, can you repeat your question a little louder, please?
Yes, absolutely. I'm
That's
wondering what impact will these changes in leadership have on health reform timelines?
I'm expecting very clear deliverables and timelines associated with this change. So as we point out what our health plan, and as it stated, the changes we were making, I want to see that actually in a format that we can report on regularly, and that people see it and feel it in the waiting rooms or in their healthcare service delivery anywhere in the province. So ultimately, our measurements will be showing the signs of improvement, and if they're not, we'll react to ensure that they do, and we'll make the necessary changes. But the real measurement, of course, is when people at Tim Hortons or wherever are having discussions, and they're saying, I got in the ER and I got my service within 2 hours, or I was in to see my doctor at the health center and I got in, within 2 days, or whatever time frame we're looking at. Those are the measurements, but I want to have a record of seeing an improvement every week in our delivery of healthcare services throughout this province.
Thank you. Aidan Cox with CBC.
Good afternoon. This has kind of been answered or asked already, I believe, but people seem to be really frustrated about the state of healthcare and wait times in the ERs. And, with this shakeup of management at Horizon and Vitalite, there must be some kind of idea in terms of a timeline that you might have for changes, and what exactly is sort of the point where you're going to be satisfied with what you see?
Well, firstly, I think it's understanding exactly where we are and what are reasonable expectations. So I don't want to set false expectations. I want to be very clear on what's achievable, and then I want to know clearly from the managers of how we're going to achieve it. I want both as part of our path forward. The timelines will depend greatly on certainly our ability, and I'll use some examples that we might say. If there was a surgery required and it would take, let's say, 2 months to have it done here in Fredericton, but you could do it somewhere else in the province, and that would be offered to someone. Say, well, we can do it here and you can do it next week. Rather than say, well, you can't have it done for 2 months. Give people options. Let's have optionality for the patient connect. So we basically say it's not just a matter of your doctor here in this community. It's a matter if there's excessive wait lists and excessive backlogs, then let's look at that. So effectively, it's not an individual system. It's a holistic managed system. So you look at whether it be any sort of surgery, and you look at across the province, how can we manage this? Because, we don't have that overall visibility. And that's what's going to change healthcare, is that we have tremendous assets here, people and our hospital network. But it's not managed collectively so that we can actually ensure that the best results are forthcoming. And that's the goal. But I can't pick a time right now. I want the authorities to tell me, okay, we can improve this by this much and by this time. And then we'll discuss that in terms of, does that meet national standards? Does that meet best practices? And that's what we'll monitor.
Thank you both. Brittany with allnewbrunswick.com. Okay, merci beaucoup. That concludes today's update. Thank you all. Voilà la fin de notre mise.
This is the end of today's update.